Hi, Dr. Sheena. So today's topic for the presentation is intracanal medicament. As we suggested in the last PPT, intracanal medicament is as important as irrigants because in between when we actually leave the patient for the next appointment, we should place some intracanal medicament which can actually reduce the number of microorganisms or to reduce the reinfection within the root canal. So first of all, what is the rationale for using an intracanal medicament? That is mainly because it actually reduces the biofilm, it actually causes the killing of the microorganism, and also the main important thing is like in between appointment, they reduce the recolonization of microorganism within the root canal. So ideal requirement is similar to that of the irrigants, which was given by Grossman in the year of 1972, saying that it should have an effective antimicrobial property. It should not cause any irritation to the periapical space. It should be stable enough. It should not react with the blood or the serum or the protein, etc. It should have a broad spectrum antimicrobial, antibacterial function. It should not stain the teeth, and it should not induce any cell mediated hypersensitivity reaction. That is very important. So talking about eugenol, eugenol is like the oldest material which was used as an intracanal medicament, but still in clinical practice we are using eugenol. That is a chemical essence of oil of clove. Because of that, it is having antiseptic and anodyne property, and it is having a pale yellow in color, and we used to store it in dark bottles because it has the capacity to age and becoming non-useful. So that is why we actually preserve it properly away from light and all. As I told earlier, along with the antiseptic and anodyne property, they also have anesthetic property. They will have a slight anesthetic properties there. So what is the mechanism of action of eugenol? First of all, it causes a necrosis of the cell membrane. It is a protoplasmic poison. That is very important term. It is a protoplasmic poison which disrupt the cell membrane. There is actually continuous destruction of the microorganism taking place. And there are two concentration of eugenol: low concentration and high concentration. Low concentration reduce the inflammation of the pulp, and high concentration actually causes the destruction of the microorganism. So the inflammatory mediators like prostaglandin synthesis is reduced at low concentration, and in very high concentration there is cell destruction, cell death, and the cell respiration has been actually reduced. Next is phenol. Phenol is the concentration is very important, 1 to 2 percentage. Phenol is again the oldest antimicrobial agent. Very important. Lord Listerine was the person who actually introduced phenol as an intracanal medicament. As that of the eugenol, it have both antiseptic as well as anodyne properties there, and the effect of phenol was not that much. So in order to enhance its property, it actually introduced the para-chlorophenol. It is a substitution of actually the phenol is there, where 1% is used. Phenol was like 1 to 2%. Here 1% is used. Another important property of para-chlorophenol is like it have the capacity to actually reduce the Enterococcus faecalis. As I said earlier, Enterococcus faecalis is a microorganism that is responsible for reinfection. So this reinfection causing microorganisms is being reduced. That is because the para-chlorophenol have the capacity to go in depth into the dentinal tubule and actually reduce the number of microorganisms that causes reinfection like the Enterococcus faecalis. Next is camphorated monochlorophenol. It is a combination of 3% of the camphorated camphor and 2% or 2 part of the chlorophenol. So why camphor was added was like it is a vehicle, and it helps in the diffusion and the movement of the material within the canal very easily. So that is the action of camphorated monochlorophenol, and it prolongs the antimicrobial activity. That is the main important thing. It prolongs the antimicrobial activity. Next intracanal medicament is N2. Whenever you hear the term N2, you need to actually think that it is a derivative of formaldehyde. So N2 is again paraformaldehyde derivative. It also consists of corticosteroids, eugenols, antibiotics, etc. But still, nowadays it is not used. That is a question that was used in asked in the MDS NEET PG. Why N2 has been banned? That is mainly because of formaldehyde, which is responsible for carcinogenic activity of our body. Carcinogenic changes is taking place because of the formaldehyde. So this is a banned intracanal medicament. Iodine again, that is the oldest material that is used. Two important concentration is normally been seen. First is the tincture of iodine, that is 5%. We know that tincture of iodine is used in surgeries, endodontic surgery, for the disinfection of that areas, etc. The later, that is a 2%, is commonly been used as an intracanal medicament. So iodine have the capacity to combine with the proteins, that is very important, combine to the proteins, and it lose, so that it penetrate and destroy the microorganism. So that is a mechanism. The other was like cytoplasmic poison eugenol. It is combining with the protein. That is a difference. Concentration is important. This is 2%. The calcium hydroxide. The most commonly and the most worldwidely accepted intracanal medicament is calcium hydroxide. And this is a very important topic, need to be studied for your PG NEET. That is, Herman is a person who introduced calcium hydroxide. It is having a pH of 12 to 12.8. This high pH is actually responsible for the destruction of the microorganism, its membrane and the protein structure. And it have a broad spectrum action. Next is the mechanism of action. As I said, it have three important mechanisms. First is like it have the capacity to uh, it has OH group. They actually get attached to the phospholipids on the phosphor. It actually induce a peroxidation reaction, and there is destruction of this phospholipids. In turn, the cell membrane is disrupted. So OH group, peroxidation reaction, destruction of the phospholipids on the cell membrane, and the cell wall is disrupted. Next is protein denaturation. Protein is bonding is there between protein. This is actually disrupted. What happens is like there is complete destruction of the protein taking place. Next is the action on DNA. DNA stranding is there. The DNA strands are often splitted by this calcium hydroxide. So these are the three important action of calcium hydroxide. First is its action on proteins, cell membranes, and DNA. Next, what is a weeping canal? Weeping canal means even after we actually clean a canal, in the next appointment when we open it, it keep on oozing out. It might be some blood or blood-like material or pus-like material. In those cases also, calcium hydroxide is actually commonly used. So calcium hydroxide has a capacity to reduce this clear or exudate filled fluid from the root canal. And Wayne suggested that calcium hydroxide can be used in weeping canal. So how this weeping canal is actually solved, the problem of weeping canal is solved by calcium hydroxide. That is because, as I said earlier, calcium hydroxide is having a pH of 12.8, high pH. So what happens when the periapical tissue, inflamed periapical tissue is always acidic. So this OH group neutralizes the alkaline group neutralizes the acidic condition in the periapical area. That is first mechanism. Second, the calcifying potential of calcium hydroxide. It build up the bone-like structure around the lesion, thus preventing the weeping of the canal. Third, they have the capacity to cauterize. Because it is highly alkaline, so it cauterizes the chronically inflamed tissue. What is the time period that is required for the calcium hydroxide to show its action? It is 1 week. Jogren was a person who actually found out that 1 week is effective in eliminating the microorganism from the root canal. Another important thing that you need to know is like, even after we do a root canal treatment, in certain cases, there will be reinfection. Reinfection is mainly because of microorganisms like Enterococcus faecalis and Candida albicans. The gold standard material calcium hydroxide does not have any action against enteroficalis and Candida albicans. That you need to keep in mind. After calcium hydroxide, the most commonly used material is the antibiotic paste. First is the Grossman paste. Whenever you hear Grossman paste, it is a combination of PBSC. From the name itself, P means penicillin, B means bacitracin, S means streptomycin, and C means caprolate. So the penicillin is acting against the gram-positive organism. So what does the bacitracin does? There are certain microorganisms which is resistant against penicillin. So the bacitracin kills those microorganisms, and streptomycin is having action against gram-negative organism. Sodium caprolate is having action against the fungi. So there is a slight modification in the PBSC paste to PBSN paste where the caprolate was replaced by nystatin. So it led to PBSN. So never get confused. Grossman paste is PBSC paste. Triple antibiotic paste, very common paste that is actually used for disinfection of the canal when we do a regenerative endodontic procedure where the lesion has to subside or larger lesion is being often treated with triple antibiotic paste. So as the name suggests, triple means three. Three antibiotic combination is seen: metronidazole, ciprofloxacin, and minocycline. So there was a slight change that took place in this combination. That is, minocycline was replaced. That is because it is having a discoloration property. So nowadays, either we use metronidazole and ciprofloxacin combination called as double antibiotic paste, or a modified triple antibiotic paste is used. Instead of minocycline, we actually replaces it with cephalosporins. So this cephalosporins actually is called as this combination is called as a modified triple antibiotic paste. Sato and Hoshina et al. Was the people who actually commercialized it, and it is also called as 3-mix MP paste. When you hear that, you need to go that it is triple antibiotic paste. And another important thing is the ratio. Always the triple antibiotic paste is mixed in the ratio of 1:1:1, and it is made into a gel-like structure with the help of propylene glycol and macrogol ointment. Again, they are added in the ratio of 1:1. What is odontopaste? Odontopaste is a combination of, again, it is actually a zinc oxide paste. It is a commercially used zinc oxide. Along with that, it consists of C for clindamycin and T for triamcinolone. So OCT, you can memorize it as OCT. OCT itself, you need to think that it consists of zinc oxide. Okay. O is odontopaste, which consists of C is like clindamycin and T for triamcinolone acetonide. Leather mix. Leather, when we actually think about the medicament which is used for treatment of most of the conditions like steroids. So think like that. It is a leader of medicaments. Leader. So leather means there is a steroid in that. Glucocorticoid steroid combination is called as leather mix. Again, it consists of a antibiotic, that is demiclocycline. It consists of a corticosteroid, that is triamcinolone acetonide, which was seen in the early odontopaste OCT, and a base, that is polyethylene glycol. So since it is multiple choice, you need to just relate rather than actually mugging up things. Leather mix, think that it is a corticosteroid is there inside that, and also an antibiotic need to be there for the antimicrobial action, right? Now, how will we place this intracanal medicament in the root canals? There are various methods. One is lentospiral. Lentospiral is actually a rotary-like material which is actually inserted into an instrument. We will actually take the intracanal medicament, place, it will rotate and it will evenly spread into the canal. That is one thing. Second is like paper points can be used to place the intracanal medicament. Katapacha points can be actually used to place. Even the files which we use can be used to place the intracanal medicament. So winding up, intracanal medicament is a very vast subject, but in a neat point of view, you need to emphasize on calcium hydroxide. One, you need to emphasize on the various antibiotic paste like Grossman paste. Nystatin was replaced by PBSN paste. Then triple antibiotic paste, modified triple antibiotic paste, double antibiotic base, its ratios, all these need to be actually considered. Hope you had a wonderful session. Thank you.